Good morning and welcome to your Farm and Home Show. I'm Kristi and this morning we're visiting with Elizabeth Westbrook. She's a cancer control specialist for the Kentucky Cancer Program. Good morning, Elizabeth.
Good morning, Kristi.
Elizabeth, I'm so thankful that you are with us today. And today you are going to talk about breast and cervical cancer screenings. Now, Elizabeth, I know that COVID has changed some things. How has it changed the screening process?
Well, Kristi, if you remember back when COVID started in March 2019, I think that was when it was
Mhm.
hitting the Bowling Green area in the beginning. A lot of the facilities locked down on elective screenings. And so people quit getting their mammograms and pap tests and other health screenings because they were saving the healthcare system. They were basically providing emergency healthcare for those who were affected by the pandemic. And so even since they have gotten screening going, a lot of people have definitely put off their screenings. And so it's catch-up time, and it's really important that people follow through and get those screenings that they missed.
It is. Elizabeth, what precautions are these facilities taking to ensure safety?
Well, they're doing a lot of different things. They're scheduling appointments a lot of times so that people aren't in the area when they come into the hospital or the screening facility where there are a lot of other patients. They're including asking people to wear masks, which helps prevent the spread of COVID, using hand sanitizer, cleaning down surfaces with products to kill any particles that would be associated with COVID, social distancing. They're really taking a lot of precautions. And so we really want to get the word out that it is safe now to get your screenings and to encourage people to get those screenings because it's so important not to delay, because we know that a lot of cancers, if they're caught early, they're more curable. And in the case of cervical cancer, and if people get their HPV vaccines as adolescents and women get those pap tests, they can prevent cervical cancer and or catch it early when it's curable.
Definitely so important to get these screenings done early. What if someone does not have insurance, Elizabeth?
Well, fortunately, CDC has a program to assist women who are uninsured, and it's called Kentucky's Breast and Cervical Cancer Screening Program. And it's available either through some of the federally qualified health centers or some of the local health departments. And so there is a number that you can show on the screen for us that people can call to find out if they're eligible for the screening. Now they have to be 200 at or below 250% of the federal poverty level, and that's based on family income rather than individual income. So it depends on how many people in your family and what the total income for the family is. They also cannot have any insurance, no Medicare, Medicaid, or private insurance. So it totally pays for the screenings. And what's good about it is if someone going through this screening were to be diagnosed with cervical or breast cancer, after being enrolled in the screening, chances are really good that they would qualify for Medicaid treatment dollars. So that's why it's so important, if you don't have insurance, to utilize a program like this. All I need to know is where I need to go. 1-844-249-0708.
Elizabeth, thank you so much for being with us today. Thank you for joining us today on the Farm and Home Show, and we'll see you next time.